Today's topic is also very important. Short note समटाइम्स आस्क इन द वाइवा MCQ में इस पर काफ़ी क्वेश्चन पूछे जाते हैं. सो दिस टॉपिक इज द एनास्टोमोसिस around scapula. So around the scapula bone, what kind of anastomosis lies between the arteries which lies around the scapula? Okay, that is the topic. Okay, so anastomosis around the scapula is very important. Short note. Before going to the anastomosis, let's see the diagram. That is very important. You need to draw the ये suprascapular notch है, एंड देन यही कंटिन्यू होता है आगे चल के कोरोकॉइड प्रोसेस. यहाँ पे आएगा हेड ऑफ ह्यूमरस. ओके, यहाँ से आती है पूरा वो स्पाइन ऑफ द स्कैपुला एंड देयर लाइज द एक्रोमियल प्रोसेस ऑफ द स्कैपुला. ओके, नाउ ये रहा एक्सिला यहाँ पे, तो यहाँ पे आएगी एक्सिलरी आर्टरी. सो एक्सिलरी आर्टरी लाइज समवेयर लाइक दिस. दिस इज द एक्सिलरी आर्टरी. Okay, so here lies the somewhere teres major muscle. Okay, so up to this, okay, axillary artery. Above it, this is the subclavian artery. Okay, फिर आती है ब्रांचेस पे. एक्सिलरी आर्टरी के जो थर्ड पार्ट है वहाँ से जो ब्रांच आती है यहाँ पे. ओके, सो दिस इज द बोथ सरकम्प्लेक्स स्कैपुलर आर्टरी. उसकी ये जो है ये पोस्टीरियर सरकम्प्लेक्स ह्यूमरल आर्टरी, उसकी ब्रांच जाएगी टुवर्ड्स द एक्रोमियम. ओके, फिर इसकी एक मेजर ब्रांच आएगी दैट इज सब स्कैपुलर आर्टरी, and that gives the circumflex scapular branch that lies over here. Okay, फिर यहाँ से आती है thyrocervical trunk, that is a branch of subclavian artery which gives the suprascapular artery that passes to foramina, goes towards the body. Suprascapular artery also gives the acromial branch over here. Then आती है दूसरी deep transverse cervical artery that passes over the medial border of the scapula and that supplies to the scapula. Okay, and suprascapular की ये acromial branch होगी. यहाँ पे आती है thoracoacromial artery, उसकी ये एक acromial branch आती है thoracoacromial artery. So this is the diagram overall. Now what is the scapular anastomosis? It is the anastomosis between the first part of subclavian artery and the third part of axillary artery. So scapular anastomosis is the anastomosis between the first part of subclavian artery and third. So this is the first part of subclavian artery and this is the third part of the axillary artery. So anastomosis between the branches of the first part of subclavian artery and the third part of the axillary artery. Now this anastomosis happens at two places. One is around the body of scapula and one is at the acromial process. Okay, so first the body of the scapula. ये body of the scapula, यहाँ पे कौन कौन से branches anastomosis हो रहे हैं. This is the one branch that is called as suprascapular branch, which is a branch of thyrocervical trunk. Okay, then the deep transverse cervical artery, उसके branches, and subscapular artery की आती है circumflex scapular artery, उसके branches. So in around the body of the scapula, branch of axillary artery, that is the subscapular artery which gives the circumflex scapular artery, it anastomosis with branches of subclavian artery mainly from the thyrocervical trunk. It gives two branches, suprascapular artery and the deep transverse cervical artery. And these two anastomosis around the body of the scapula. That is the first, the anastomosis around the scapula. Around the acromial process, the arteries which are anastomosis around the acromial process. First is this artery, that is the acromial branch of suprascapular artery. Acromial branch coming from the posterior circumflex humeral artery and acromial branch of thyrocervical trunk. These branches anastomosis around the scapula, around the acromial process. So axillary artery की branch posterior circumflex humeral artery, which gives acromial branch which goes towards the acromion, and second part की branch thoracoacromial artery which gives acromial branch. So this is the branches of axillary artery. And the subclavian artery which gives the suprascapular artery, which is a branch of thyrocervical trunk and which gives branch the acromial branch. These anastomosis are around the acromion. So this is the anastomosis around scapula. Okay, how you have to write? You have to draw this diagram where what is the scapular anastomosis. It where occurs? Body of the scapula, acromion. At the body of the scapula, axillary artery के कौन से branches है, subclavian artery के कौन से branches है. Around the acromion, axillary artery के कौन से branches है and subclavian artery के कौन से branches है. They get anastomosis. So what is the clinical importance of this anastomosis? There is a collateral circulation. So importance is collateral circulation development. So axillary artery is the main artery which supplies the upper limb. If it get blocked between the below the first part of subclavian artery up to the third part of the axillary artery, if it blocks, it hampers the blood supply to the upper limb. At that time this anastomosis get it work. Blood flow यहाँ पे अगर ब्लॉक हुआ कहीं पे तो blood flow is directed to the suprascapular deep transverse cervical and goes through these arteries into the circumflex scapular and subscapular and through acromial anastomosis and give the blood supply to the distal part. That is the importance of this collateral circulation. ओके, सो ये एक इम्पॉर्टेंट शॉर्ट नोट है, एग्जाम में काफ़ी बार पूछी जाती है. एमसीक्यू में पूछा जाता है कि सब स्कैपुलर एनास्टोमोसिस अकर्स बिटवीन फर्स्ट पार्ट एंड ऑफ सबक्लेवियन आर्टरी एंड फर्स्ट पार्ट ऑफ एक्सिलरी आर्टरी, फर्स्ट पार्ट ऑफ सबक्लेवियन आर्टरी एंड थर्ड पार्ट ऑफ एक्सिलरी आर्टरी, थर्ड पार्ट ऑफ सबक्लेवियन आर्टरी एंड फर्स्ट पार्ट ऑफ एक्सिलरी आर्टरी, third part of the subclavian artery and third part of the axillary artery. Like these options are there. So what is correct answer? Scapular anastomosis occurs between the first part of subclavian artery and third part of the axillary artery. Okay, so that kind of questions are asked on this topic. So दोस्तों, अगर आपको ये वीडियो अच्छा लगा तो मेरे चैनल को प्लीज़ लाइक, शेयर और सब्सक्राइब ज़रूर करना. थैंक यू वेरी मच.